Welcome back to Medical Terminology Chapter 2. In Chapter 1, we learned the basic parts of a medical term and we learned the rules for putting those terms together. We are going to specifically in Chapter 2 look at suffixes. Remember that suffixes are placed at the end of the word. The definition of a subject is that it changes the meaning of the medical term. It is used to denote singular or plural forms of the word, and it can denote part of the speech. Now remember, you need to have the combining form to add the suffix, to link the suffix. So you need the root word to link to the suffix using a vowel, and that gives you the combining form. So down here you can see gastroscopy. This is, you have the word root, you have the combining form with the O, the vowel, and the suffix. Now when you look at suffixes, there are four major things that your book is going to talk about. Surgical suffixes, diagnostic, pathological suffixes, grammatical, and diminutive, diminutive meaning small, and then singular or plural. So let's get in and look at some of those. Okay, so surgical suffixes describe a type of invasive procedure performed on body parts, and here are three examples: appendectomy, arthrocentesis, and a lithotripsy. Now as we go through here, we're going to learn the definitions of these. Okay, so here are some suffixes that you're going to want to remember. The excision or removal is ectomy. A surgical puncture is centesis. Crushing would be tripsy, and the separation, destruction, or loosening is lysis. Okay, to break or surgically fracture is classis. Fix is pexy. Suture is raphy. And surgical repair is plasty. Okay, forming an opening is stomy. Binding or fixation is desis. An instrument to cut is tome, and the actual incision is tomy. Okay, some of the pathological means disease. So these are used to denote procedures to test for the disease. So one example would be electrocardiogram, or they call that an ECG. You've probably heard it as an EKG as well. And then you have gastroscopy. Okay, so the instrument used for examining would be a scope. The actual visual examination would be a scopy. Another instrument recording would be the graph, so that would actually be the recording that you're looking at, and the process of doing it would be a graphy. So don't get these two, 3 and 4, don't get those confused. They are two separate things. Okay, an instrument for measuring would be a meter, like a thermometer, and the physical act of measuring would be metry. Okay, the recording of it or writing it down would be the gram. Okay, so some more pathological suffixes that we'd be using would be to describe abnormal conditions or diseases. And here are 3 examples: neuralgia, gastritis, and hemorrhage. Okay, so pain, some of these suffixes can have the same meaning. So pain can be algia or dynia. The formation can be plasia or plasm. Forming, produced, or origin can be gene or genesis or genus. To burst forth can be reg or regia. Swelling, edema. Hernia, notice that it has the same swelling, could be seal. Stone or calculus could be lith. Abnormal condition, osis. Involuntary contraction or twitching could be spasm. A narrowing or restriction could be stenosis. Discharge or flow could be rhea. Disease is pathy. Inflammation, you guys have used this one before, is itis. Tumor is oma. Rupture, rhexis, and paralysis would plagia. Okay. Dilation or expansion, ectasis. Vomiting, emesis. Blood condition, ema, or abnormal condition, eesis. Now we get into grammatical suffixes. So attached to word roots to form parts of speech such as adjectives, remember they describe, and nouns, which is a person, place, or thing. Gastric would be an adjective. Neural would be an adjective. Obstetrician is a noun, and pneumonia would be a noun. Okay, so diminutive suffixes, remember diminutive means to make smaller. So tube, you add the ule, which makes tubule, which makes a small tube. Arterial, which makes a small artery. Okay, notice that all of these, AC, AL, AR, airy, ick, ill, and us, all are adjectives, and they all mean pertaining to. So some nouns, isis, ia, or ism, all are conditions, and and more noun suffixes, ishin or ist means somebody that specializes in that area. So a physician or a physicist, they specialize in that area. Okay, medicine or treatment would be eteri, and once again the small diminutive would be ickle, oul, ol, and ule. Okay, more plurals and suffixes. Changes when a word is modified from a singular to a plural. So instead of, we go from diagnosis to diagnoses, or bronchus to bronchi, or deformity to deformities, plural. Okay, change the following terms to their plural form. So thrombus would be thrombi. Ovum would be ova. Fungus would be fungi. Diagnosis would be diagnoses. Okay, so now let's see if we can answer these questions. The crushing of a stone would be lithotripsy. Forming a new opening or a mouth in the colon would be colonostomy. Excision or removal of the appendix would be appendectomy. Okay, so look at these. Diseases of the joint, instrument to examine a joint, inflammation of the stomach, and surgical puncture of a joint. We have the disease of the joint would be arthropathy. Instrument to examine the joint would be arthroscope. Inflammation of the stomach would be gastritis. Surgical puncture of a joint, arthrocentesis. Okay, here are some more. Structure of a muscle. Binding or fixation of a joint. Forming an opening into the trachea. Okay, so structure of the muscle would be myopathy. Binding fixation of a joint, arthrodesis. Forming an opening to the trachea, tracheostomy. An instrument for recording the heart, recording of electroactivity in the heart, and pain of a nerve. Instrument for recording the heart would be cardiograph, recording of electrical activity of the heart. So this is an electrocardiogram because it's the actual physical record of doing it. If it was the activity, the physical activity of recording it, it would be different. Pain of the nerve would be neuralgia. Forming or producing an origin of cancer, softening of the bone, and abnormal conditions of stones. Okay, so forming or producing the origin of cancer would be carcinogen or carcinogenesis. Softening of the bone, bone is osteo, remember, osteomalacia. Abnormal condition of stones, lithiasis. Remember, stone would be like a kidney stone or a gallstone. Okay, then we have hernia, swelling of the liver. We have a swelling of the lymph gland, tumor composed of lymph tissue, and bursting forth of blood. Okay, so hernia or swelling of the liver, remember hepat is liver, so hepatocili, swelling of the lymph gland, lymphedema, tumor composed of lymph tissue, lymphoma, remember tumor is oma, and bursting forth of the blood is hemorrhage. We also call that just bleeding. Okay, so this gives you an introduction to suffixes. Now please go and complete the activities on the medical language lab.